Hello, my name is Dr. Ronald Kall. I'm a physician here at the Keck Medical Center of USC. Our team at the USC Spine Center wants to ensure every patient has the best possible experience. This video will cover what to expect during your hospital stay. Remember, your primary surgical team, including your surgeon, physician assistant, and nurse coordinators, may add to or change some of the recommendations. Always go by the recommendations first and ask questions if you are unsure of any information. The day of the surgery, please arrive to the hospital 2 hours prior to your scheduled surgery. Admissions and the Gold Lobby waiting room is located on the first floor of the main hospital. You will meet our spine surgery team, including hospitalist, nurse, case manager, and physical and occupational therapist. Your hospitalist will coordinate your medical care and pain management with the surgical team throughout your stay. You will be required to fill out consents prior to surgery for risks such as bleeding, infection, nerve root injury, paralysis, and death. These conditions are very rare. A nurse will place an IV, start fluids, and draw additional labs if needed. The anesthesia team will give you something to relax. They will place a breathing tube and Foley catheter to monitor your kidney functions and neuromonitoring. Intraoperative X-ray and CAT scans may also occur during your surgery. Leave a phone number of a family member or friend you would like to receive updates. A member of the surgical team will keep them updated. After surgery, you will be transferred to a recovery room. Once you are stable and pain is controlled, we will transfer you to another floor. Sometimes patients must go to the surgical intensive care unit for additional monitoring and then transfer to the medical surgical floor when they are more stable. If outpatient recovery, you will receive discharge instructions, your prescription, and a collar or brace if needed. For outpatient procedures, a member of the occupational therapy team will meet with you before discharge. Once in your room, you can expect the following: frequent neurological and vital sign checks, blood pressure and heart rate checks, an incentive spirometer hourly to help your respiratory system and to prevent pneumonia, supplemental oxygen as needed, speech therapy, antibiotics, stool softeners and laxatives as needed, IV fluids as needed, restarting all your regular home medications. Lastly, if you have sleep apnea, we will provide you with a CPAP machine for sleeping, or you can bring your own from home. Please also expect the following: physical and occupational therapist the day after surgery, ambulating out of bed 3 to 4 times daily, a brace or collar placed on you after surgery if needed. During your stay, you will have the following: midnight blood draws, sequential compression devices to assist with circulation, injections to prevent blood clots, and you may have a drain placed during surgery to prevent fluid collection. Please let us know if you have any dietary restrictions. We do recommend having meals in a chair. Nothing by mouth until positive bowel sounds or passing gas for anterior abdominal approaches. A soft diet for anterior cervical approaches. After surgery, you will have the following: a pain management service, oral pain medications and muscle relaxers with a pain push button or other IV narcotics for breakthrough pain. If you are in the ICU, you will receive IV pain infusions. Our goal is to transition you over to an oral pain regimen you will be able to go home with. Pain after surgery will be higher than what you came in with, but you will feel better later. When you're in the hospital, we will manage your pain for the first 24 hours by giving you IV and oral pain medications. The goal is to manage your pain. Working with our physical therapist will help reduce your pain. You will be prescribed enough pain medications for home upon your discharge from the hospital. If you have any questions in regard to this, please contact our PAs or nurses at the USC Spine Center. If you are in pain for more than 2 weeks after surgery, please see your pain management doctor. Remember, the discharge planning sheet we ask you to complete prior to coming in for surgery helps our discharge team effectively plan your discharge and better coordinate your care. Your discharge plan may include the following: home health, physical and occupational therapy, caretakers with out-of-pocket expenses, transitional facilities, acute rehab, subacute rehab, skilled nursing facilities. If you don't have a caretaker at home, you will be likely going to a skilled nursing facility, which depends on your insurance. Only qualified patients will be going to an acute rehab unit. The Keck Acute Rehab does not accept all insurances, so placement will depend on your insurance. To avoid placement delays, please contact these facilities beforehand. If you know that you'll be going to one of these facilities, please come in with the names of 3 facilities you would prefer. Here is a link where you can look up approved facilities. If you'd like to speak with someone regarding discharge planning, please call the Transitional Care Coordinator at the Keck Hospital. You can find the phone number in your pre-op guide. If you don't have a driver or transportation to get you home when you are ready to be discharged from the hospital, Keck can provide assistance and get you home in a medical van or in an ambulance. However, not all transportation is covered by insurance plans. You may have to cover these transportation costs out of pocket later, so please arrange for transportation. Thank you for watching Part 3 of the Keck Medicine of USC Spine Surgery video series. Please watch our 4th video in the series to learn more about physical and occupational therapy.